name's Angelica. I am the owner of Samia's Plant Studio. And I stand with the Black Organizing Program at Planned Parenthood.
I'm Alex Wright, and I'm a member of the Planned Parenthood of Illinois Black Action Council, as well as Senior Counsel for Labor Relations at Cresco Labs. The fight toward comprehensive sexual and reproductive health care requires all of our hands, because together we fight for all.
Thank you for joining me this morning to talk about Planned Parenthood and the Black Action Council. I want to start by giving you space to discuss sort of how you arrived at this juncture of organizing and like where your passions fall towards the fight for sexual and reproductive health care.
Yeah, so when I first moved to Chicago from Phoenix, I was trying to figure out ways to get involved in the community. It's usually really important to me when I move to a new location. And I really didn't do much, honestly. I did some training with prenatal yoga just to help people move through that process. I then had a child, and then I started volunteering, but I didn't take what I would consider to be meaningful steps toward making sure that other people had the support and the information and the resources that I was blessed to have as I went through my parenthood. So that's why this group has been really, really important to me, just even on a personal level.
Of course. We have a pretty robust legislative agenda this year. And there are very few things, I think, holding Planned Parenthood back from sort of achieving its full potential. And at the top of that list is the Title X. So the Title X program allocates funding for family planning across the U.S. And a great deal of Black and brown pregnant people rely on those public dollars for their neonatal care, for their STI screenings, what have you. And unfortunately, there was a gag rule attached to the Title X program stipulating that these public dollars cannot be used for abortion funds. And, luckily Medicaid budgets are operated federally, but also through state budgets. And Governor Pritzker rejected those funds and made sure that there were enough dollars allocated towards abortion care. In 2015, Planned Parenthood centers served 1 in 4 people in Cook County who were looking for contraceptive care. And as of summer 2020, there are 6 counties in central Illinois that have no Title X operating centers in their entire communities, even though 100,000 people in the state rely on those public dollars for access to basic healthcare services, not just abortion care, which is critical, right, but birth control, STI screenings, cancer screenings. So I'd love to hear your perspective on the Title X program and what the short and long-term impact of resolutions like that will have.
Yeah, I'm always fascinated when I hear of things like a gag order, because there's obviously a very pointed interest in policing our bodies. And even that in itself, the idea that, you can affect, let's say, whether someone gets an abortion or gets access to care, and because you want to bring this life into the world, and yet there's nothing on the other end that says, okay, life is very, very important to us, and so here are all these resources that we will provide you to care for this life that we are forcing you to have, right? And so that, just the whole package of what it means to be provided with the resources and the educational tools to make sound decisions and then to, carry out your decisions in the world is super important to me. And I think, part of the conversation has to be, it's not just about like, okay, you don't agree with abortion. It's about what are you doing to support family if that's so important to you.
Yep. I think you just touched on 2 very important things. One, this idea that contraception and abortion care is new, as if people throughout history have not always planned their families and planned the trajectory of their families, but also this fallacy that anti-choice people are pro-life. Right, because in reality they're pro-birth. And their intention is to legislate what happens in these rooms, in, doctor-patient rooms, but then, like you said, not provide resources to make sure these people who you've now legislated have to be, born. And
not even pro-safe birth.
Exactly.
Right? It's just, please give birth to this child in whatever conditions, with whatever information you have. And so it's really not pro anything. It's just, I'm pro-control.
Absolutely. And that goes right into the Hyde Amendment, which is the Senate version of essentially the same thing. So the Hyde Amendment, which is not a law, but it's been attached to several Senate appropriations bills, which essentially does the same thing. It bans federal funds from being used for abortion care. And initially, it only affected Medicaid, but now it has similar language in the Children's Health Insurance Program, in Medicare, and in the Indian Health Services, and all of these different groups of people who are disproportionately impacted by the lack of health care. And now we're adding additional restrictions on top of those. Not to mention, we've seen similar language be adopted by state legislatures. We have local state legislators popping up across the country, introducing fetal heartbeat bills and heartbeat bans, where folks are saying, well, if you can hear a fetal heartbeat, then that means you shouldn't be able to have the full spectrum of reproductive health care, when in reality, in some cases, you can hear a heartbeat as soon as 6 weeks.
Before you know you're pregnant.
So far before most people know that they even have a pregnancy. So I'd love to hear also your perspective on that, and maybe some enthusiasm you have about the incoming administration to that end.
Yeah.
Maybe.
Just as perhaps a nonpartisan issue, I would like to hope that our goal is to advance education first. I think it would be kind to say that all of the people who have certain opinions are educated about their opinions, right? I would hope that we just maybe learn more about women's bodies and how they work, and learn about the impact of those decisions, and then actually talk through, okay, if you decide that we want to stop a birth at 6 weeks, or you want to stop the right to terminate a birth at 6 weeks, then what happens? Then what support are you going to provide? Because look, we're with you. Life is very important. Like, let's do that. But also, what resources are you providing to sort of account for the consequences of the decisions you want to make for women and families?
And I think also the cumulative effect of these decisions as well, because banning abortions isn't going to make abortions go away.
Right.
It's not. It's only going to make the process less safe. We've seen what happens across the country when folks don't have access to safe and legal abortions. They're doing back alley abortions. They are, like, in the worst cases, inflicting personal harm to themselves in order to, like, have an abortion. So there's it also just doesn't make sense. Divorcing the morality that's used to legislate this issue in terms of actual health care. We've seen that, like, when you put these kinds of bans and restrictions on communities, particularly the ones that don't have the resources to make sure that that this fetus that you have been forced to gestate, that they have good schools to go to, that they have all of the necessities to become a healthy and whole human, you're just told, no, you got to have it.
And then you're on your own.
And then you're on your own.
And we haven't even touched on the mental health impact of this. Think about, if I don't want to be a mother and I'm forced to now have this child. Now I have this child and I have to decide to raise the child or give them to someone else to care for. But each of those decisions has an impact on the mother and on the child and on the family and on the community. I mean, I love my child very much, but there are some days where I would just like a little break, right? And so just think about having to, let's say I don't want to give my child up to somebody else. I now am caring for a life that I did not intend to care for. It's a lifelong commitment that you're forcing on other humans.
Absolutely. And speaking of, that's a perfect segue, speaking of children, I'd like to talk about the REACH Act. So the REACH Act is at the top of our priority list for state level policies. And this is a complete overhaul of the way we teach and provide sexual education for the K through 12 demographic, particularly a framework that is gender and identity inclusive. I'd love to hear your perspective from the various hats that you wear throughout the day.
I guess starting as a mom, so my son is going to be 6 this year. And I'll tell you, we started conversations about consent when he was like 2. It's as small as, I know you love hugs, babe, but you have to ask somebody before you touch them. And if they say no, you have to respect that. And the same goes for you. Like, there are conversations we can have with our children in age-appropriate ways that give them the tools to keep themselves safe and to respect other people's autonomy as well. And I think, as we touched on earlier, that's really what I've envisioned sex ed to be. It's not just about the anatomy of, like what we did when we were kids, like how to make a baby, how to prevent, STI. It's really about how do you act with autonomy? How do you respect other people's autonomy, including in your mental health and your identity? Those are things that I think children really can handle. And so as a mom, I think it's important to me. I've done it at home, but I would like to know that each child has the opportunity to have that information. As a former, administrator in higher education, you already know how, when you send your 18-year-old off to college, the inputs that they have had in those previous 18 years wildly affects how they behave in school. And I don't mean behave just in terms of like, am I a person who is going to harm someone else? But also, do I understand my rights? If harm comes to me, do I know where to go? Do I know that I have the right to say no and get help and be respected and all of those things? It's something you have to tackle from all angles, and it's not something you can just teach in a Title IX class on your first day of freshman year. It starts really early. So the REACH Act is very, very important to me, like as a mom and as a former person in higher ed.
Absolutely. And I think, like you said, before working at Cresco, you were VP and general counsel at a really big university, and you have had your hand directly in Title IX cases and seen the cumulative effect of having a sexual education framework that does not really serve anybody, and that is rooted in this like false premise of abstinence and the idea that pleasure and autonomy and all of these things don't exist for certain groups, and that it's supposed to be for one group and everyone else is supposed to kind of just fall in line. So
then having this hard line, right? Like, you can't just tell a teenager, just don't do it, it's fine, like don't worry about it. Like, that doesn't work for anybody. Anybody. And it's not wise. What I have seen from my own child is that giving him the information behind all of my advice helps him to hear my voice when he's on his own. We can't raise robots. We have to raise humans that are capable of managing all of the situations they encounter. Exactly. And again, not just in terms of protecting themselves, but respecting another person in terms of, and it goes, through what you would like to be called, what your name is, what your gender identity is. All of it, I think, just ties into this idea of respect that we have to instill in our children from the very beginning.
Absolutely. I'd like to close out with talking about COVID-19.
Yeah.
So I very much value your input on this, having been, like we said, an administrative executive at a university, but also now working as a counselor for labor relations for a pretty big and emerging field. Yeah. So, I recently got the part 1 of the vaccination. Luckily, the Illinois Department of Public Health was insistent that Planned Parenthood be among the first wave of folks to get it. So I'm very grateful. I'd love to hear some of your insights as someone who, you work with unions, you work with the folks who are in these warehouses, the essential workers who've kept this economy afloat. Yeah. What are your thoughts?
What I know, at least of our employees, is that their opinions on things like vaccines and masks vary wildly by location. And I think my position is going to be, you have to make the choices that are safe and healthy for you. If I respect everyone's autonomy and everyone's right to choose, I can't mandate a vaccine. Now, Cresco hasn't taken a position yet on that, but I don't think that we will be mandating it. I think that our goal will be to make sure that it's available to everyone who wants it, and that for people who do decide to opt out, we have some mechanism in place to protect the workforce while we're still waiting for herd immunity to develop. So it really is, for me, two-part. It's making sure it's available for everybody who wants it, making sure that everyone has the time off to go get it when it's made available, and then, what do we do with the company at large? Because at some point, hopefully, we will not be wearing masks anymore as a community, maybe like 10 years from now, whatever. But, I think as an employer, it's really hard to mandate something like that. Yeah. There's so many exceptions, whether it be religious or otherwise, that would prohibit you from doing it 100%. So I think the better approach is to just make sure that it's available and have procedures for protecting people who decide to opt out.
Absolutely. And, Planned Parenthood does not directly offer the COVID vaccinations, but we believe it is important for us to be strong third-party validators for getting the vaccine, but also addressing the very real reservations that Black and brown communities understandably have, about any facet of medical science. So we're very much looking forward to the various organizing activities across our spring advocacy efforts that address that history. And I shouldn't have been doing this, but I was scrolling through Twitter and folks were talking about the COVID vaccinations, and a very popular talking point when talking about vaccinations in Black people is the Tuskegee experiment. And there are these widespread misconceptions that these were Black people who were given syphilis, when in reality they had syphilis and told they received a vaccination and never did. But there are tidbits like that have been so distorted by various malicious factions in our country, whether it's the ultra-right or the ultra-anti-choice or whomever, that take these things and then they distort and contort them, and then it somehow filters its way back into our communities through whatever channel. And there are these things that we are confronting every single day. And it's, as a Black person, I don't feel comfortable telling other Black and brown people you have to get the vaccine, because I get it. I understand. Our very own organization, Planned Parenthood, our founder, Margaret Sanger, had her hands in some very nefarious medical science experiments that were being conducted on Black people, on Puerto Rican women. So the history exists. And I think we maintain the same framework that we need to make sure there are mechanisms in place that everyone can get it. And that it is safe for everyone to get, and that we are being considerate of the ones who do not get it, and that there are safety protocols in place for the people who don't get it as well.
And then educating them. I think the questions are fair. And, we've talked a lot about access to different resources and education, what have you. If you don't know what the Tuskegee experiment is about, that's okay. But ask the questions so that you can be provided with information. I've seen the tweets about microchipping and what have you, and fine. And I think a lot of people are joking, but at the heart of it, I think there are valid questions about what a vaccine means, whether this is safe. It was quite rushed.
And we've not seen a vaccination distribution plan like this, at least in my lifetime. I've never seen this, and the last one I can genuinely remember is polio. I can't think of another time in recent history that we've had this, and there are well-founded skepticisms that people have about medicine and pharmaceuticals and all of the above. But I do believe that it's important for, our public health director, Dr. Ezike, was one of the first people in the state of Illinois to get that. And I do believe that sends a very powerful message to Black folks who are skeptical when you see one of the foremost public health voices saying, hey, this is good to take. It opens the door for that conversation and for some truths to be told.
Yeah, but I think even with that, you're going to have people who think that there's one version of the vaccine for the wealthy and one version for everyone else. And again, I think at the heart of it, we have to take everyone's questions seriously and provide the information that would enable them to make informed decisions. There's not much to do beyond that. We hopefully will never be in a situation where we are forcing people to get a vaccine against their will.
Orwellian. If we had to force people to get vaccinated.
Wouldn't have shocked me, maybe a day ago.
True.
But I don't think that's the right path. I think providing education and resources and allowing people to make informed decisions is always the best way.
Absolutely.